Have you thought to check for Chagas disease as a possible diagnosis for your patients? Meet Anna, an infectious diseases consultant. Anna's Izzy clinic regularly receives referrals from across her region, which is endemic for Chagas disease, an infection caused by the parasite Trypanosoma cruzi and spread by kissing bugs. Anna's first patient is Miguel, a farm worker from a remote village at the edge of the forest. Miguel awoke one morning with swelling on his face. His village is already aware and cautious about kissing bugs and the risk of the Chagas disease that they carry. When, a few days later, he developed a fever, his doctor suspected that it's Chagas disease. The next patient is José, who moved to the village 30 years ago. When he moved, he didn't realize that his newly built home was infested with kissing bugs. José was unaware that he had picked up the infection and had parasites in his body until he developed heart problems later in life. Maria's case is unusual. She lives a long way from where kissing bugs are found. She and her family drank fresh sugarcane juice that was contaminated by trypanosomes because infected bugs were crushed during the preparation of the juice. Because they received a large dose of the parasite, the whole family quickly developed severe symptoms of fever and nausea. Blood tests identified their high parasite load. Finally, Julia is here with her baby. She was infected whilst pregnant, but didn't develop symptoms. However, the parasites passed to her child, who was born very ill. Tests then showed both mother and baby carried Chagas disease. Around 75 million people are at risk of Chagas disease. 6 to 7 million are estimated to be infected, and only around 1% of these get diagnosed and treated. Early diagnosis is critical, as the parasites are only detectable in the blood for around 8 weeks. After that, they hide in the body in low numbers, slowly damaging organs and tissues over time. Treatment is available and is simple. Anna prescribes tablets for her patients, and everyone's infections are controlled. And José receives ongoing care to manage the health of his heart. Ask your patients where they came from and think about the possible opportunities for their infection. Anna says, remember to check for Chagas.